This is a brief outline, but I want to focus on the very last bit of the slide, which looks at your washroom. So you will ask, why the washroom? But just imagine, and I want us to really imagine, the day we will have yourself walking into the washroom and being able to come out knowing everything about yourself. I keep saying we have very many medias that we actually release in the washroom, from combing your hair to cleaning your body to actually passing whatever effluent you're putting into the toilet. Yet, this really is a hub for technology. And we should be able to have a self-looking glass every time we come out of that room. So the evolution of technology, what really brought it about? The field of development, origins of health and disease. But we increasingly note gender and socioeconomic inequalities not only affect women, but extends for generations. We've had success with innovation since 1965, but it calls for what? Active participation in research and development, the breaking down of silos. And Nandita, next year, please make sure we're not just talking to health personnel, but let's get even the owners of this block to come here, the educators, the agriculturalists. So you will find even in my presentation, why is it we have to move into multi-sector? The commercial arm with technology. In 1976, we got startups, boom. 1987, computer networks and social effects of technology, this side of the room. In 1994, intelligent technologies began to take vogue, and healthcare was not left out. Humans and machine skills to promote effective, efficient, and innovations in health. So we ended up having what we call the technology superhighway. It identifies the infrastructure we need, the capabilities, and the gaps, prioritizes initiatives, allocation of resources, and I will stop here and tell you, India, last year you had 984 million dedicated to technology, an increase from 2023 of close to 90%. But where are we as health sector providers? Are we joining the fold or are we being left behind? Humans began to develop, and you will see this even in my presentation. But we also have increased in monitoring and performance matrices and predictive indices. But what are the different types of technology we have today? You can have evolution over time, which is really the one that moves from A to B to C, or it can be disruptive. COVID came, and I think a lot of you realized how much you didn't know in terms of technology until the disease became global. And then there was a rush into how do I teach from my house? How do I get to know the data that's unfolding every day? These are the things that everybody, whether you liked it or not, you were pushed into being technologically savvy. So that's disruptive. Then there is transformational technology. We see this in healthcare, and particularly in oncology and assisted reproductive technology and contraception taking the forefront. And then breakthrough innovations, stem cells, rejuvenation of the ovarian tissue are just two examples. But we need to refocus and ask ourselves, how do we get there? The first thing is we identify a problem. From the problem, you have an idea. How can I sort this out? From there, you have a concept that you develop and you form prototypes. From prototypes, you actually put it to play. And if it works, then you think of scaling up. We've seen this very often, particularly when we look at postpartum hemorrhage as an example with emotive, the use of tranexamic and heat-stable carbetocin, just to mention one or two. But we need to take a step back and ask, what is really the problem and why is it we're trying to push technology? And where can we make a difference? And I thought two places are the most important for us to focus on. The health infrastructure. What are the issues? Inequality. And I'll emphasize inequality. The rural woman vis-a-vis the urban woman. What do they have available to them? Yes, you may say everybody has a mobile phone. But in the rural populace, she probably depends on the husband to lend it to her once in a while. And even then, do they have internet connectivity? Do they have the buying power to be able to utilize it? Communicable diseases. And I must talk about malaria, HIV, TB. They're still plaguing us. And today, even non-communicable diseases are on the increase. Poor sanitation services. And you will ask, why are you looking at sanitation? But when you think of climate change, you think of vector-borne diseases, you think of waterborne diseases, then you begin to realize we've got to focus even on sanitation and removal of those toxins and effluents that have an effect on us. Manpower shortages. India is no exception. Most of us are urbanites. What do you do for the people who are in the rural areas that require the same quality of gynecological and obstetric services? What do you do in Africa where you have a major brain drain into high-income countries? Are those people not entitled to have quality of care? Malnutrition. Again, the malnutrition of lack, the malnutrition of excess. And the fact that we have fetal programming that even predisposes that young one to non-communicable diseases right from what is inculcated in utero. The role of private sector. I have walked around Nandita, this whole conference, and I kept asking myself, how many of us here are in private sector? How many of us are in public sector? But more importantly, how many other sectors are we engaging with? A big problem. And yet you will see why it's important we make a difference. This is a bit of a busy slide, but extremely important. We have public health coming in the foreground, unlike before, particularly with emerging diseases and with the inequalities that exist in health and the gender disparities. And in public health, you have the foundational pillars, which look at what? Surveillance, epidemiology of disease, laboratory capacity. Oftenly, we don't think of the lab, but it is so integral. Hazard preparedness and response. Policy development. The normative environment must be enabling for us to even think technology. How do we communicate with our patients? I was speaking yesterday in an adolescent session, and I was told by one of our colleagues here that she's finding it very difficult to develop an app that communicates to the young. And I said, unless you meaningfully engage them, their language is not the same as ours. They speak a different dialect. So communication and health literacy is critical. Community partnerships for development, extremely important. But we also need to reorganize and reshape our organizational competencies, the use of leadership and governance, health equity, accountability, performance management, financial management, and legislative. In public health, areas that we do focus on very often, communicable and non-communicable diseases, chronic diseases, environmental health, maternal, child, and family health. This already gives you the picture. We're looking at sustainable development goals in totality. The planet, the people, prosperity, partnerships, and even looking at the progeny of tomorrow. We cannot ignore it. And then access and linkage to clinical care. At the top, it doesn't matter which program you belong to, but these are the foundational pillars we must focus. So I asked myself, is technology therefore a tool or a toy? And I've even put a picture of the car that I found downstairs here. Just to tell you that Geo is actually your tech hub for India, the biggest, the largest, and moving very, very fast. But how many of us have even asked, where is the owner of this complex? How many of you have even looked to interact with them? Big question. Nandita, you've been here. You had to plan for this Congress. Has any one of us bothered to even go and approach them and ask, can you please engage with us as healthcare providers? The turning point was COVID-19, which happened to all of us. We got locked down. We were stuck in our homes. We were giving lectures for those of us who are in schools online, but we had to learn the learning management system. Nightmare. Some of us were born before computer age. So it was really a very steep curve. And really it became what we're calling the revolution in industry in the fifth dimension. I want us to just focus in the middle area that speaks to what? Data. We suddenly got an upsurge of data globally. When is the peak of COVID happening? How many peaks happened in your country? What happened during the peak time? And what happened during the downtime? But we began to realize data analytics has become a vogue. But looking at the bottom of the slide, you will quickly realize we needed to speak to getting masks, which meant we're talking to textile industry. We needed to look at computation and software upgrading. Again, a different set of skill set. We needed to really rethink our Internet of Things. It no longer became the basic. We needed even to look at connectivity. So even looking at the linkage with Google and with Microsoft and with IBM, these were not things we thought consciously about, but this happened as a result of COVID. But I looked at India because I like being very well applied, and I asked, in India, is it COVID that you started having technology with? And oh, no, lo and behold, India has had a history over 200 years. You have religion, you have science, you've had fiction, you have people who've read the cosmic. We have a lot of techniques moving into technology, and I think my previous speaker even alluded to some of the surgical techniques. Open surgery for fetal anomalies. Emotive as something that's now more recent. But we've moved from techniques to technology. The astrobiology, I think all of us are cognizant. When you look and listen to Elon Musk and you listen to Ambani, they all want to move into the cosmic. Why? Why, Jaydeep? They're looking for other areas and seeing if we can put life somewhere else. We're looking at robotics, and the robotics is what's being known as the humanoids. So we're definitely having disruption, and you can see the number of books that have come out from India. But I'll start with a very basic tool. How many of us have our mobile phones on us? How many? Hello? It's interactive, all right? So you have technology in your hand. And I will ask a question after this, but these are some of the things. In India, it started really in 1975. That was your turning point. And I've even given you the first mobile phone. But we became more aware and more informed. We engaged and participate with one another. And we have become conscious of the next person and what you really need to know even as an individual. So here's my question to all of us. What's your hotline if you have an emergency? Anybody? In India, what's your hotline? Your husband? Oh, I like that one. He may not be available. What's the hotline number? Jaydeep, what's the hotline number for India? 911? It's what? 100, 105, 112. That is for India. But guess what? I'll teach you something today. If you click on the side of your phone, some phones it's 3 times, sometimes it's 5 times, or you even can dial on a switched off phone. You just switch it on and just dial the emergency number. It will go. So I can tell you, you already don't know what your phone does for you. But ordinarily, what do we do with our phone? We can communicate. It has internet access. It has application apps. You have cameras and imaging. And even nowadays, as surgeons, we tend to take images if you're not even in laparoscopy, where you want to do maybe a case study or you found an interesting finding, intra-op. But you need to have very good acuity to be able to do it. Health fitness. So how many of us have got health fitness on our phones? How many? In a crowd, okay, roughly maybe 40% of the crowd. Well done. So we must be knowing how many steps we are taking to come here. So the harder question is, how many steps should you be doing on average in a day? How many steps? Hello? Huh? 10,000, 7,500, you're good. If you haven't reached there every day, you're doing badly. You'll be like me. Navigating and mapping, the GPS system, mobile payment systems, emergency call line, as I have alluded to. But we have moved. We don't just have the smartphone. We have the World Wide Web. I like focusing on this because now we are global. I can reach Edgar Ortiz in Latin America. I don't have to go there. I can reach Asia Oceania in Malaysia, or I can reach wherever I want to go. I can do it from the comfort of my own home. Cloud computing, artificial intelligence, which we will focus on, 3D printing. You heard this over and over again during COVID. Renewable energy, biotechnology and genetic engineering, then the Internet of Things in everything and anything. But we have novel delivery and manufacturing and analytical processes of the same. New systems for drug targeting, particularly in oncology, stem cell biology, an example, the rejuvenative medicine, and novel technologies for antibodies and vaccines. This is all coming up. Application of artificial intelligence and machine learning to drug discoveries and development. It's no longer the laborious laboratory-based thing. We can model. Point of care testing and diagnostics. Monitoring devices. So how many of us have monitoring devices on our hands and can actually monitor quite a bit, even when your phone calls you? CRISPs. This is actually where we're now even breaking our DNA molecules and realigning them. These are the new cuts that are happening. And I just put this to show you, NIH has a depository or repository we can even look upon for human medicine and animal medicine. So you will ask, in India, is it there? It is. We have very many genomic labs. I call it the study of the omics, because we have genetics and epigenetics, we've got metabolomics, we've got proteomics, and the list goes on. So we're no longer looking at the macromolecules that constitute the human being, but moving to the finesse. And we all need to move in that direction as we speak, even technology. And then I went to McKinsey Company, and if you haven't started looking at these reports, please start. It actually gives you guidance of what's cutting in the world. And you can see clearly within the technology realm, if you're not doing data and AI, you're a little bit retrogressive. Connectivity and platforms. In fact, Joey has one of the best connectivity platforms possible for India and beyond. Robotics. I know a lot of people are saying there are aliens coming, and we keep being told on TikTok, aliens are coming, and aliens are coming to do good. How many have heard that conversation? But I can tell you for free, it's actually robotics. There's a massive manufacturing of robotics going on for those who are abreast with technology. And we can begin to say, yes, these are the things that will actually be human-like to facilitate us. But we have other things, the Internet of Things, augmented reality. So this we're using particularly in simulations in our training programs and even in training people. Digital fabrication, new materials and biotech. But we cannot leave out clean technology. So I want to ask of those of us who are still working in hospitals, how many of us have bothered to see the greening of our hospitals? How many? How many? You see, very few. I've told you it's going to be interactive. But the trend is continuing on an upward trajectory. The biggest tech companies in Mumbai, I have listed for you at the extreme right. And you need to plug in. Jaydeep, you may have finished your term, but you need to plug in with these guys if you need to move further, faster. So there is some disruption happening for all of us, for impact. So we have chatbot for health education. Aman, I don't know if any of you know about Aman, but Aman is really a body that is looking at reduction of maternal morbidity and mortality in India using tech. They're leveraging on technology, they're leveraging on infrastructure, equity-based provision of care, and data-driven for evidence. Community empowerment tools, AI and data analytics. We're predicting increasingly high-risk pregnancies, evaluating low areas of access, precision-targeted care. The healthcare provider can no longer sit pretty and say, I am doing my core business of fixing patients. You must be part of the conversation that's interrogating data. And even for government planning and policy environment, strategic direction, return on investment planning, we must use data as part of it. We've also got what we're calling the large language module. So again, how do I communicate with the young? How do I communicate with the woman in the rural village and I don't even know Kihindi? This is what's going to help you to be able to communicate, answer their frequently asked questions. And I've given it to you. We need to have the language for use in customer care, content creation, and software development at the bottom of it. It is increasingly becoming very popular, particularly for mental health. And we know, especially after COVID, this became a major problem. Data analytics, we have a lot of tools. I've only sampled a few, but I wanted to ask questions. I told you I want to be interactive. How is my business performing after I introduce rapid diagnostic testing? Nandita must be asking that every time when she's looking at her luteinizing hormone and her ovulatory predictions. But listen to the next two questions. What is the effect of climate on hypertensive disease of pregnancy? It's becoming more complex. How does health equity affect performance indicators in maternal and perinatal health? We need data sets to be able to answer these questions. Yes, WHO has given us for a very long time, World Bank, UNICEF, we know those data sets. In country, we have the DHIS. UNICEF has been doing the MICS studies. But today, we even have bigger data sets that even inform our policy environment. I don't know how many of you know about IPUMS. If you don't, please look it up. You've got your Google on you. FP 2030, as of December, they are releasing a data set. So your DHIS will probably be talking about the married woman and her family planning demands being met or the unmet need. But with the FP 2030, now you can begin to tease out even contraception amongst the unmarried, contraception amongst the adolescent and the youth. So you need to know what's coming up every time. But again, you must begin to start looking at data interrogation and AI assistance in the same. So with big data, there always is a question. And I want to ask a few questions. How many have attended this Congress? Nandita, how many? 10,000, assume. So, how many of them were the indigenous Mumbai population? These are simple questions. But are there any differences in the delegates that have attended? I'm getting a little bit deeper. What are the most popular sessions attended? How do I relate the return on investment spent at this Congress to the gains academically, to the networks we have made, to the social demand and the desire to attend the next year's Congress? What is the projection for next year? These are some questions, but when you look at it, look on your left. You're actually now using technology to think through those questions, the tech in your mind. Then you have to do analysis. You have to automate all your data. It'll give you insights. You will see the business sense when you begin to start analyzing data. Decision-making will be dependent on the evidence you have generated. And again, we can then do predictive modeling. Really, that's all we're talking about when we talk about tech stuff. But we have other disruptions. Supply chain innovations. How many times have you asked for supplies and they get lost through the cracks, particularly in the public system? Now we're using systems that are foolproof. Blockchain for supply chain transparency. Behavior change communication tools for health messaging and even gamification. Social media advocacy. These are some of the things that you're going to be seeing more and more, and you must engage in. Innovative financial tools, advocacy and accountability tools. We are saying the gynecologist should stop only being a clinician, but participate in advocacy. Become the health diplomat in and outside health sector. So crowdsourcing, public health dashboards, and advocacy tools that actually do analyze big data. But that's not it alone. We're not just going to talk about data and analytics. We have the technologies that are evolving with devices and equipment. Contraception is a very good area where things are moving and moving very fast. We have multi-purpose technology, medicines that are coming up. We need to be in vogue of those. The rest I have spoken in relation to PPH. So how do you monitor your blood? How do you check for anemia? Non-invasive methods are becoming a norm. How do you look for your blood sugar? Non-invasive methods are there. The drugs and the pipeline of drugs that we can use, heat-stable carbetocin, tranexamic acid. But look at the bottom of that particular slide. These are people engaged in technology in India. But I asked a very hard question, Nandita. How many of us are actually talking to the tech world in healthcare? If you really want to make good money, you need to go into this space in a hurry. Technology is a business, so that's what I want to talk also about. Technology can cross-cut all sustainable development goals. It provides an opportunity for equity with the ability to reach the last mile. And I put for you a lady in the village. Technology can contribute to the workforce fluidity, helping people retrain and businesses to deploy human resources, especially where there's scarcity. Where you don't have human resource, use tech and minimize time and cost. In our age, we are looking for certain things: productivity, growth, prosperity, and to replace mundane tasks. When we talk about women coming in for prenatal care as an example, and group antenatal care, how many times can you repeat the same message? You'll be exhausted. So what you do is you kick in technology to do the job for you, and you concentrate on your core business of taking care of the patient. But it requires you to set up that system. And certainly, where you're more efficacious, you will earn more money. Technology improves your job security, your standard of living, your health, your education, your environmental sustainability, and offers equal opportunities. It optimizes social transfer models, mobile payments, so you don't have those little loopholes for corruptibility. Technology can support innovation and even grow smaller health systems, and even environmental sustainability. It can be used. A small case in point would be all the trash we are carrying here, how you collect it, but you charge per the consumption. Similarly, for health effluent, the same. But there is an ecosystem. The ecosystem here, I'm just looking at us in health sector. You have the governance elements and the health industries you must work with. You as a provider, whether you're going to be a researcher or you're going to be an academician or you're going to be a practitioner or you're going to be a private provider, we all must know. And finally, the consumer. You want to make the experience for the consumer optimal. That's the ecosystem. And when you look at the ecosystem, it also comes with partnerships. We have to partner outside of health sector in a hurry if we are to remain relevant. But I want to focus now on the woman. That's our core business. I need some water. Water? That's our core business. But why are we focusing on the woman today? Three things. Women are affected differently. Particularly when you look at things like cardiovascular disease or autoimmune diseases or Alzheimer's. Women are affected disproportionately. I keep repeating with the rural woman. I don't want to look at the urbanite because the urbanite may afford. And women have uniqueness. When you look at maternal and gynecological health, we have unique entities that can affect us. So definitely we must be caught up in the bandwagon called technology. When you look again at the McKinsey report, it's very clear. The gynecologist onlyness is about 5% of women's issues. We have more coming in from mental related issues and other communicable and non-communicable diseases. And yet we know there is an interface and an interplay of all those other diseases affecting maternal and gynecological health. But why I put the Davos, and why I want to put even the World Bank, and why I want to put even NIH, which is the research machination, all of them are doing one thing, including COP 29 and 30. They're saying we are recognizing women are the foundation for development, for empowerment. And you heard this even from the introduction before I spoke. And therefore, you will find more and more research being geared in the direction of women. We're currently working with the Davos Economic Forum on looking at the policies that should be governing women's research. COVID brought a change and made us refocus that you must look at the woman. This is actually a draw up on the Bill and Melinda Gates guidance that we've been given for innovation and the opportunity map, where it's very clear, focus on the woman. You will have new markets opening, mortality reduction, stronger economies and leadership, improved outcomes. And note, it's not just for the woman. She's been given the privilege to carry it into generations. So what do you need to look at? Data, research, regulation, innovation, social and structural determinants, training and careers. And then the specific disease states that do affect her. This slide, it's a busy one, but it just shows you what kind of unfolding in terms of partnerships you get. Women have a life course approach. So the outer circle shows you very clearly Today I'm a young girl. Tomorrow I'm a mother. The day after I'm in geriatrics. And then the general care. And how technology is really opening up partnerships for all of us. Healthcare innovations. What do we have? Telemedicine, artificial intelligence, advanced medical devices, patterns of recognition, prediction, precision medicine. We've seen this with colposcopy. We've seen this with point of care, ultrasound. Pick out the pathology on this slide. Where is the pathology? Anybody? The top or the bottom? With your pap smear. Hello? Where is the pathology? Nobody is talking. It's at the bottom. But sometimes we have inter-observer variances. So what is now technology doing? It's actually taking all these pictures and coming up and saying, yes, our prediction is this, because we have looked at very many slides that are showing pathological specimen. And this is the vogue that we are all supposed to be moving into. Point of care ultrasound. AI, now we're not even saying that you need to go and really study 110%. Ultrasound. AI is there to facilitate this and make women survive, babies survive. Gynecological pathology equally recognized. So, what do we have when it comes to assisted reproductive technology? I think really that's where advances are running. Gamete and embryo selection, personalized treatment plans, things are changing. Fertility diagnosis, robotics and automation in the processes. Genetic screening, this was alluded to by my previous speaker, and enhanced success rate. In oncology, what do we have? Drug discoveries and development. So we are designing and doing clinical trials that are optimized. Protein structure predictions. Personalized medical treatment. So we're having targeted medicine. We're no longer looking at blanket provision of chemotherapeutics or radiotherapy in patients. Synthetic genomics, which I had alluded to much earlier. In areas of disaster and hardship, war-torn areas like we do have where there's geopolitical turmoil, early warning systems, drones and robotics are being used, mobile apps and GPS tracking, geographical information technology, particularly where we're now looking at bioterrorism. These are things we must keep abreast of. So you can see AI has come to sort out a lot of things: patient care, medical imaging and diagnostics, research and development, and your work as a physician. It's all happening. Clean technology. We cannot ignore the role of the environment. And I must say, I really emphasize on the role of the environment because that's where women work every single day. And we need to protect it extensively. Education and awareness. Transport and traffic safety. We're now moving into an era where we want to have automated vehicles. And I really saw this car downstairs and I said, we need the ambulances. Only to go and look and to find that India is still way ahead. You have the Zenzo car that's being done. It will not be driven by a driver. It'll be automatic, directing patients, collecting patients, and taking them to hospitals. So we are moving in that vogue, and we need to be part of it. Nutrition, I can't stay without talking nutrition. On my extreme right, you have the woman who traditionally has been the laborer. Every single day, her fingers move 500 times over, digging and plowing, so that people can eat in their homes. She plants, she weeds, she sows out, she harvests. That's her work, particularly the rural woman. But what is happening in today's world? We are now thinking technology to increase the yields and also give her time to be able to participate gainfully as a productive citizen. So technology has come up. But you see, look at the gender issues. When technology comes, who starts going to the farm? The man. So I made sure I put the two pictures together so that you remember, we've got to really be gender parity. all through. But also look at the entrepreneurship as an ecosystem, business planning, marketing strategy, research, networks and partnerships, so that we have impact in this world we live in. So there are papers that I have put there also for you, starting with the one that says, think nutrition first. Disease states come, but if we can all think nutrition first, we would be winning in terms of NCDs and communicable diseases and what goes to the progeny that we do carry as women. What will happen with technology being taken up, and particularly by all of us? We will operate with excellence. We will have optimal use of our capital. We will accelerate growth all round. But there are management issues that we also tend to gain. Decentralization of healthcare will happen. Focus more on preventative care. Collaborations of global impact. Sustainability in healthcare. Building of resilient health systems we so desperately need. Public-private partnership. Workforce development with a difference. And advancing universal health coverage. So the question begs, do we then need super specialists? Nandita, do I really need you as an IVF specialist tomorrow with AI and Jaydeep? That's the question. And people are asking it very seriously because patient care is now moving in a different direction. Community-led innovations are happening. But we have one thing that the human touch cannot be subsidized by technology. So we certainly still need you. Plus, we need the knowledgeable person at the maximum. But this is what we have to really secure. Costs and accessibility. Initially, the costs may be high, but cumulatively, the technology will bring the costing down. We must integrate it into a normalcy. But we have ethics. And I must say, we all know AI has the good and the downside. Biosecurity is becoming a problem. Cybercrimes is becoming a problem. Security and privacy of data. But we must imbibe, take them on, but also be cognizant the policy environment must cover the wrong. So finally, what is the role of FIGO in technology? I think with the few words I have spoken, you can then understand why it is we insisted during this particular group of leadership, technology must become a fulcrum in FIGO for our member societies. Reason being, we must become visionary in our leadership and even in our execution of healthcare and taking on a multi-sector approach. Equity-driven approaches. Remember my public health slide. Strengthening of primary healthcare and the role of community health workers. A digital leap is needed even in obstetrics and gynecology. We must harness our local expertise with a difference. We must integrate into the policy environment of today and not of yesteryears. We must strengthen our research and development because that's where innovations come in. We must begin to have global partnerships. I talked about the connectivity and platforms. And we must undertake collaborative advocacy and accountability. Remember the large language model I spoke about. And lastly, I want to speak to we for STREE. And I'm going to say, Hamstri Kelie. We are here for women. But I want to challenge the professional women in the house. Where are we in our health agenda? Our voice and agency matters. Our research agenda matters. We have the lived experience as women, coming in not just as a professional expert, but as a mother, as a sister, as an auntie. So how much more should I be calling all of us to action? Let us join hands together as an unstoppable global movement. But I'm not leaving out the men. I want the men as agents of change and our allies in this quest. But we must all take up technology.
Thank you, Professor and Kihara, for this wonderful talk